Hello everybody, and thank you for joining me today on my 1000 WellDays proposal for WellSpan Health. First, I want to thank Dr. Kevin Moser and the various board members that were able to attend today. I know you are very busy and I appreciate you taking the time to be here. First, I want to go over what I will be presenting today, giving a summary of the 1000 Days program that is already in place throughout the world, our implementation here at WellSpan, our marketing agenda, what research and funding went over into this proposal, and our adaptations that we would be using for WellSpan, and how 1000 WellDays can help us as an organization. And then I'd like to open up the room for roundtable. 1000 Days. 1000 Days is a nonprofit program that is designed to help fight the malnutrition of mothers and their babies within the first 2 years of life. In response to scientific research that identified the time between the baby's conceived up until their second birthday, which is 1000 days, nutrition plays a key role in the future and the development of children. According to the 1000 Days website, I'm going to quote here, 1000 Days works to improve nutrition for the most vulnerable, and in some of the poorest parts of the world, malnutrition continues a serious public health crisis in nearly every country on earth, including our own, the United States. We recently expanded our work to build partnerships and efforts to bring attention to the issues of poor nutrition, food insecurity, and obesity that are impacting the future health and well-being of America's youngest children. So this is why it's very important for WellSpan to help our own community as they face the very same issues as the world of poor nutrition, food insecurity, and obesity. I'd like to go back again to the Commonwealth's Division of Health Informatics, their statistics. So in York County in 2015, 3,117 babies were born. Lancaster County, 892. Lebanon County, 769. And for Adams County, 518. So that gives a grand total of 5,296 babies born that we helped as an organization to birth in 2015. So this is why not only is it important from the time of conception that we intervene and help the mother become nutrition savvy, know what to eat, how to feed their baby, as well as once born, how do we help our new mothers help their babies be healthy. So that leads me to the implementation of 1000 Days. So I would like to introduce you to 1000 Days, 1000 WellDays. So the 1000 Day program identified through research that 25% of U.S. children between 1 and 2 years of age do not have recommended dietary allowance of iron, which is a key brain building nutrients, and that 10% of U.S. children exhibit signs of overweight or obesity before reaching their second birthday. So WellSpan needs to ensure our younger population makes a difference in their health. This in turn will help our future community be a healthier one. So how are we going to do this? We're going to do this through our mission. Our mission is working as one to improve health through exceptional care for all, lifelong wellness, and healthy communities. So we want to help jumpstart our healthier community by impacting mother's nutrition, infants' nutrition, whether they're breastfeeding or formula feeding, and how we can help our children continue on that path of healthy eating. In addition, our organization's vision is captured through several goals. These goals can be found on our website, as many of you know. Caring for all, we believe that everyone deserves the essential care delivered in an exceptional manner, regardless of race, gender, ethnicity, sexual orientation, age, economic status, or ability to pay. We focus on patient and family-centered care, making sure we're fulfilling our promise to those who entrust their lives and the lives of loved ones to our care and our highest priority. Respect and integrity to each and every one of our patients, as well as our devotion to continuous learning and stewardship as employees. So all of these things must be thought of when deciding upon this program. So I do hope that you do take it into consideration. Strategy. So 1,000 days, I would like to propose that we do this in 2 waves. So with permission granted by the founders of 1,000 Days, I would like for WellSpan Health to begin a collaboration with the program by offering 1,000 WellDays. This incorporates the WellSpan branding of Well. Our marketing department can begin campaigns to advertise to the program. To start, I would like to have a Press-Ganey survey be sent or mailed or emailed out to our community. We first need to know who are our stakeholders. How many pregnant women do we have in our community? How many women are new mothers? How many women have children that suffer nutritionally? So anyone who identifies themselves as being pregnant, having a child under the age of 2, or is planning to become pregnant is our target audience. The first wave of advertising of 1,000 WellDays program will be introduced via traditional routes such as radio advertisements, PDF mailers, billboards, posters within our various locations such as maternal fetal medicine, our OBGYN offices, and many of our affiliates where our new mothers or pregnant women go to receive care. Within the advertising campaign, we would have a 1-800 number posted. This will be published for patients to call regarding the collaboration between 1,000 Days and 1,000 WellDays. This 1-800 number will be staffed by existing employees, so it's not that we have to hire anybody for this initiative. We will have already existing staff ready to answer calls, to answer questions about this collaboration. The second wave of advertising will include social marketing techniques. So I'd like to go back to some text that I've read from Denauer et al. And they're quoted in saying, at one end of the continuum, we find people who are motivated to act on bias of information. Those people are likely to adopt a recommended behavior because they are able to see it is in their best interest. This is where I suggest offering educational classes as part of a pregnancy program. Such classes will be scheduled at their regularly scheduled checkups, and during this time period we would suggest being during their 2nd or 3rd trimester. On the other hand, Denauer et al. Continues stating populations at the opposite end of the continuum are resistant to recommended behavior. They may not see a change in behavior as self-interest, or making the change may be too much trouble. So this is why it's important for WellSpan to make the program fun, but offering incentives. So we could offer incentives as we do our employees. We can offer free massages or discounted massages, discount cards, yoga sessions, give out Fitbit devices to help our pregnant women and our mothers stay active and have that way of fighting obesity. All right. And so you're probably wondering, well, this is an okay idea or a great idea. How are we going to fund it? First, I would like to discuss the research that was involved. So as 1,000 Days is already an established program, they're very successful. They came up with 10 building blocks that is very important in the first 1,000 days. So this includes a nutritious diet for mothers during pregnancy, good care for all mothers during pregnancy, exclusive breastfeeding at the first 6 months, a nurturing, responsive care and feeding of babies and toddlers, the right foods introduced to the babies at the right times. In addition, a healthy and nutritious diet for babies and toddlers, making sure that our babies and toddlers, or toddlers who are at the age to introduce new items, aren't consuming so much of our added sugars. Having the right knowledge and skills for parents and caregivers to properly nourish their young children. Sometimes these new moms don't know what to feed their children and offer them whatever they may want at the time. Consistency with access to enough nutritious foods for our families and young children, and making sure there's societal investments in the well-being of every baby and toddler. These are important factors that we must continue with WellSpan. So in order to ensure that a plan goes smoothly, as I'm proposing, it is important to ensure that the sustainability of the program before it even begins. So we want to make sure that we're offering research and evaluating how things are going as soon as they start to be implemented. In order to ensure a plan goes smoothly, it is important to ensure that we are researching and utilizing 1,000 days, and WellSpan may initiate the moving all the departments involved to potentially provide care for patients. This will help with us to know where do we need to shift more focus. So funding, WellSpan already gives back $126 million in charity, and that's a number stated from 2015. By adding to this cause, WellSpan has the opportunity to work with more local businesses, community members, and health and human services. In turn, we hope that like they have before, that these certain channels will share the same ideas and initiatives that we have and will help back us financially. Now we're on for WellSpan Health. So 1,000 days was now integrated into 1,000 WellDays. A few characteristics of the program must be modified. Even though it's a very great program, we do have to make sure it fits our healthcare setting. So first, the key building blocks that we already mentioned must be molded to fit our organization. So my first change would be to implement a discount card to any of our organization's food services for all of our pregnant patients and our new mothers. So this would mean for all 5 of our hospitals in York, Adams, Lancaster, and Lebanon, and Good Samaritan. I think I did say that. I apologize. Would offer this discount card for our patients. We suggest that this be implemented in the new patient packet that all new mothers get at their first OB appointment. The Well card can offer these patients a form of payment, a discount card at all of our food services. So this is preventing mothers from going out to gas stations or fast food restaurants where there's poor nutrition, and offering them the already great nutrition we have in our hospitals. Next, I would suggest changing and adapting and actually creating a work group for nutrition services, pediatrics, maternal fetal medicine, and our OBGYN facilities. So essentially all of these areas is where our pregnant women and or our babies will venture in their healthcare journey. So by combining WellSpan Nutrition Services and all of these groups, they can work together to find the best ways to educate our patients. In addition, I feel nutrition services can provide education to not only new mothers, but to those who are maybe already are mothers, but they're starting off and they want to start fresh. And this is where we can help. So as we know, there are chronic diseases that are directly related to nutrition. Where this comes into play is gestational diabetes. According to the Mayo Clinic, again, I apologize, I'm going off here and quoting again, but gestational diabetes develops during pregnancy. Like other types of diabetes, gestational diabetes affects how your cells use sugar. Gestational diabetes causes high blood sugar that can affect your pregnancy and your baby's health. Any pregnancy complications is concerning, but there's good news. Expectant women can help control gestational diabetes by eating healthy, exercising, and if necessary, taking medication. Controlling blood sugar can prevent a difficult birth and keep you and your baby healthy. In gestational diabetes, blood sugar usually returns to normal soon after delivery, but if you've had gestational diabetes, you do have the risk for type 2 diabetes later in life. You'll continue working with your healthcare team to monitor and manage your blood sugar. So the Mayo Clinic says it right there. We can help our patients during pregnancy with nutrition, exercise, and various programs or initiatives to help our pregnant patients stay healthy. So more specifically, we're hoping that WellSpan Nutrition Services could collaborate with endocrinology and mind, body, and health to possibly help, through nutrition seminars, glucose reading classes, and yoga sessions. One of this chronic disease could hopefully, this patient could have an outlet to stay healthy and have that support system that they need. And in addition, by monitoring your blood glucose closely, as well as dieting and exercising, you can also prevent from packing on the pounds that some people do with pregnancy. And this is where it comes into our second chronic disease that can be initiated by pregnancy is obesity. Most women, it is difficult to lose the baby weight once they do have a baby. So having that postpartum support in the community, 1000 WellDays can help with that through nutrition services. As I said, we could hold classes at our family education center throughout our various counties in which we serve. And this would help with gestational diabetes, not only that, but hypertension, obesity, and it will help our community to become healthier. For taking the time to come out today and listen to my proposal. I do have hopes that you do take this seriously and that you do consider this 1000 WellDays proposal. Again, the reason for the initiative and the research behind this is the first 1000 days are so important and they go so fast. So let's make it our goal to help our community, help our mothers, help their families act upon those days. Help them make those days count nutritionally, educationally, keep them active, help the mothers, be safe and healthy in their food preparation. And through employee collaboration and patient dedication, we can make 1000 WellDays at WellSpan a success. Again, I want to thank you for your time, and I hope you have a great day. Bye-bye.